I want to thank Zoe and Mark for helping me set up today with all the technology and being able to present. I also want to, I'm very thankful for the opportunity really to share about MST services for veterans. Before I start, I'd like to give credit for the presentation slide deck. This was created by our National MST Support Team, which they're allowing me to use today. So I wanted to make sure I gave credit for our slide deck today. So as I begin presentation today, I want to share about the VA administrative structure, which is really helpful as we help veterans navigate the VA for MST related services. So you can see here, the Department of Veteran Affairs is broken out into 3 administrations. We have the Veterans Benefits Administration, or the VBA, where veterans can go for disability compensation, educational benefits, vocational rehab benefits, as well as home loans and life insurance. There's also VHA, and that's where I work, where the focus is medical treatment and mental health treatment. It really is the focus of our work is treatment and recovery. And also we have the NCA, the National Cemetery Administration. I'll be talking about VBA and VHA today as we discuss MST services. I first want to talk about what is military sexual trauma. You know, VA's definition for MST comes from federal law, but in general is sexual assault or repeated threatening sexual harassment that occurred during a veteran's military service. It's important to note it can occur on or off base while a veteran was on or off duty. The identity of the perpetrator does not matter. It could be someone they know, they don't know. And the reason for the assault or harassment also does not matter and can include hazing. When we think about military sexual trauma, it's important to consider MST as an experience and not as a diagnosis, especially as we're working with veterans in their treatment as well as care. A little bit more about what is military sexual trauma. It is any sort of sexual activity in which someone is involved in against his or her will. Someone may be physically forced into participation, unable to consent to sexual activities, maybe being intoxicated, pressured into sexual activities with threats or consequences or promises of rewards. It can involve things such as threatening offensive remarks about a person's body or sexual activities, threatening and unwelcome sexual advances, unwanted touching or grabbing, including during hazing experiences, oral sex, anal sex, sexual penetration with an object, and or sexual intercourse. And compliance does not mean consent. It's helpful to discuss how common is MST. When asked about experiences of MST, the rates are 1 in 3 women and 1 in 50 men tell their VHA healthcare provider that they experienced MST. You know, this data is captured only from veterans who choose to seek care at the VA, and I'll talk a little bit more about how we capture that data. I want to note, like in the past, these numbers recently changed. It used to be 1 in 4 women and 1 in 100 men, and recently it changed to 1 in 3 women and 1 in 50 men. So we want to note that although women experience military sexual trauma in higher proportions than men, because there's a larger number of men in the military, there are significant numbers of men and women at the VA who've experienced MST. We also know from the data that veterans from all eras of service have reported experiencing MST. When looking at mental health diagnosis, diagnoses associated with MST, PTSD is commonly diagnosed and associated with MST, but by no means is the only one. Looking at our data at the VA, the most common diagnosis for MST-related mental health care, PTSD, major depressive disorder, major depression, schizophrenia, and psychosis, substance abuse, as well as mania and bipolar disorders. Now I'm going to share about the Veterans Health Administration response to MST. The response includes a universal MST screening, free MST-related healthcare, MST coordinators at every VA medical center, as well as a national MST support team, the one who helped me who prepared this presentation slide deck, education and training of staff, as well as outreach to veterans. So for MST screening, research tells us that many people will not share about a sexual trauma. So recognizing that many survivors of sexual trauma do not disclose their experience unless directly asked, it is VHA policy that all veterans seen for healthcare are screened for MST. There's a universal screening. It really does allow us to ensure that veterans are aware of services available to assist in their recovery from MST, ensures providers are aware of an important aspect of a veteran's history, and it conveys VA's awareness of and sensitivity to the issue of MST. The screening is conducted in a private setting by qualified providers, so they're provided training. And when veterans do share that they have experienced military sexual trauma, they're offered a referral to mental health for further assessment and or treatment. Usually they're offered a same-day appointment or scheduled within like a day or two of sharing about experiencing an MST. So the Veterans Health Administration provides free MST-related health care. So that includes mental and physical health conditions related to MST, outpatient, inpatient, and residential care, and also medication. So as veterans come to us for care and they report that their difficulties or their providers find that the difficulties or concerns they're sharing about, that it is related to MST, that care is free. Eligibility for MST related care is really expansive. I find that when I'm working with different staff or providers, the question comes up like, can the veteran qualify or are they eligible for MST related care? So I'm thankful that we have this slide today to really help spell that out for us. So individuals do not need to have reported the experience of MST at the time or have other documentation that they occurred. Individuals do not need to initiate MST related care within a certain period of time after their experiences of MST. And also, veterans may be able to receive MST-related care even if they're not eligible for other services. So typical length of service and income requirements don't apply. So oftentimes, one of the things that I do is I help our VA staff is to register our veterans who may not be eligible for other VA services, help them register at our VA for MST-only care. And I think I have a question in the chat box, which I'll get to. Veterans do not need to file a claim or be service connected or even want to file a claim. So they can come to the VHA, and if they share with us, I have experienced an MST, our approach is we believe them. There's nothing they need to prove. And then we ask them, would you like to meet with a mental health provider? Also, it's important to note here, former service members with an other than honorable discharge and current service members can also receive certain MST services. I think probably this last bullet here, people find that it's really helpful to reach out to me to kind of navigate the other than honorable discharge because they can receive MST related care. So we got a question from Vicki. Are the details about the MST event shared in the patient records and who has access to their records? Thank you for your question, Vicki. The clinical reminder, so that reminder that we had talked, that screener that we talked about, it does show in their chart that there is a positive MST screen. The details of the event it doesn't need to be written in the chart with that clinical reminder. However, some details may be in the chart depending on their clinical care and if it's relevant to their clinical care. So if they're psychologist or therapist or psychiatrist or even their medical provider, they may need to write some details down to provide the medical care and mental health care needed. And who has access to the records? VA staff who are seeing the clients should have access to the record, do have access to the record, and providers and staff should only be accessing a record if they need to. So a little bit more about mental health care services available. So the Veterans Health Administration, we have a full continuum of mental health services for veterans who experienced MST. Every VA medical center provides MST mental health outpatient services, including psychological assessment and evaluation, psychiatry, individual and group therapy, general mental health and specialty services to target problems such as PTSD, substance use, depression, and homelessness. This last bullet here about outpatient MST related counseling is also available at community-based vet centers. So veterans who've experienced MST can also seek care at vet centers. They are able to go to vet centers for MST related care. Some of the veterans I work with find it's helpful to start seeking care at the vet center because they're maybe not ready to come to see us at Tripler, where our VA is located, and want to kind of start in the community first with the goal of coming to VA Pacific Islands for care down the road. I think in the time of COVID, maybe there's a little bit more flexibility in that because we're doing a lot of telehealth and telephone treatment right now. We also have residential programs available for MST, mental health, addictive disorders, medical conditions, homelessness. So there are many facilities that have residential treatment programs. We don't have one located here in Hawaii. However, if a veteran does get connected to services at VA Pacific Islands and establishes mental health care with us, we can help them navigate getting connected to one of those residential programs. Of course, VHA has inpatient programs available for acute care needs, focusing on psychiatric emergencies, promoting stabilization, or facilitating medication adjustment. We have that at our VA as well. We partner with Tripler, and our inpatient program is located within Tripler and staffed by VA providers. So the last bullet here, a number of these residential and inpatient programs focus specifically on MST or have specialized MST tracks. So sometimes it'll be like a women's only PTSD program. There's also national a residential program out in Florida that is specific for MST treatment of MST at Bay Pines VA. So I think there are a number of programs and that veterans could be connected to if needed. We found that veterans sometimes opt to stay in Hawaii because of distance and do individual care or group treatment with us here as well. But residential programs are available for veterans too. So for gender sensitive care, so VHA has both single gender and mixed gender programming available. Some veterans will benefit from treatment in an environment where all veterans are of one gender. Mixed gender programs also have advantages. The specific needs of a veteran dictate which model is most clinically appropriate. So the veteran will talk about this preference with their provider as they're developing their treatment plan together. And part of the ability to offer these kind of gender sensitive care, sometimes it depends on kind of local demand and the resources. We do try to honor if a veteran does request have a gender preference for a provider, and if we're able to provide it, we do seek to make that happen for the veteran. To access care, veterans can ask their existing VA healthcare provider for referral to MST services. They can contact me, the MST coordinator at their local Veterans Health Administration facility, also contact their vet center. We also do have a VA webpage that veterans can go to, you all can go to as well, for veterans wanting to seek care or access care related to MST. A little more about MST coordinators. As I shared before, every VA has an MST coordinator and serves as a point person for MST issues at the facility. For VA Pacific Islands, I'm that person. I'm responsible for ensuring MST related monitoring, treatment, and education and training occurs. Most MST coordinators provide some clinical care, but MST coordinators typically are not the only clinician at the facility providing the mental health treatment to the veteran who experienced MST. The MST Coordinator is the best point of contact to assist veterans in accessing MST-related care or answering any questions about local services. In working with community providers, oftentimes the questions are about eligibility and navigating the registration process, or other more specific questions. So, I welcome all of you to contact me if something does come up, and I'd be happy to assist. We also have a VHA National MST Support Team. They're wonderful. They support me in doing my role here at VA Pacific Islands. It was established in 2006. It coordinates really our national efforts for MST-related education and training, promoting best practices in the field through consultation and technical assistance. They perform our national monitoring as well as provides consultation to VA Central Office on MST-related policy issues. They also respond to information requests from VA leadership and other stakeholders. And I find them to be a really helpful resource for me as an MST coordinator, and also to our providers that are treating veterans who've experienced MST. Let me see here. So staff and education. So another response the VHA has had is to really promote staff education and training, so that they know that MST survivors present with a range of health problems and seek care in a variety of healthcare settings. So primary care, general mental health, specialty care. Because of this, it's essential for a broad range of providers to be well informed, and the VHA offers a range of national MST-related training opportunities for staff. So this also includes a national monthly training, or actually, yeah, it's a monthly training calls. There's an annual virtual conference. So I've been able to attend for many years. If not, it would be more difficult for me to attend all the way from Hawaii. But our staff can join me in doing the virtual conference every year. There's online courses, and also a community of practice and intranet website, which has a lot of resources for us as providers at the VA. Also, all mental health and primary care providers at VHA must complete mandatory training on MST. This is a training that is highly tracked, and the VHA really wants our providers to know what is MST and how may it impact the clinical work that they're providing. So this is something that they have really put an emphasis on in the past few years, even more. And also the VA's National MST Support Team, they have an MST consultation program. So any VA staff member can contact them directly, and they're really quite responsive. Our time difference in Hawaii, it kind of works to our advantage. If you send an email at the end of the day, they'll get it in the morning on the East Coast time, because that's where they're located. And they do actually respond quite quickly to those emails and helping to provide guidance for us. So a little bit about outreach and access to care initiatives. So MST coordinators, we do local outreach, develop partnerships, and we do other efforts to really get the word out. The MST support team engages in national efforts and develops resources for use by the field. So there are outreach posters, handouts, and educational documents. We have all of those out in all of our lobby areas, including at our community clinics as well, that highlights information for veterans. They're also another resource which I have found really moving as well as helpful to utilize with veterans. It's called Make the Connection, 2 different websites, Make the Connection and About Face. They feature veteran stories of recovery, and have found it really powerful as veterans are considering to seek care for MST. They have found it helpful to hear from their veterans, kind of their experiences of getting treatment and engaging in recovery. We also have, the VHA also has helped, it's helping VA answer the call. So an ongoing MST support team campaign is to support the MST coordinator's efforts in educating frontline staff in their facility, such as telephone operators and clinic clerks. So what this means is every year, a few times a year, the National MST Support Team will call our VA, they'll call our call center, they'll call our community clinics, and they will see if that call can get to me as the MST coordinator. So this is really a national effort for every VA to ensure that veterans are able to reach me as the MST coordinator or the MST coordinator at any of the VAs. I do provide education and support to our call center as well as our clinic clerks so that veterans have a positive experience when they do call our VA in asking about MST related services, and help our frontline staff to know what is MST and then how to help manage that call in a way that is sensitive to an individual's privacy and concern. We also do Sexual Assault Awareness Month efforts. It's usually done in April, but with the pandemic this year, we weren't able to hold a Sexual Assault Awareness Month events. We'll do some virtual events later later this year, and probably we'll do more of a virtual events next year if we're still not in person yet back at the VA. The MST Support Team does support us. They give us national educational and awareness support. Some of the events that are hosted, you may all have seen kind of clothesline projects or ribbons of support or wear teal days. So we usually do Teal Tuesdays. We encourage staff to wear teal on Tuesdays during the month. We also do a noon conference talking about what is MST for our providers as well. And here is my contact information. The best way for staff and providers to reach me, you can email me. You also can call me. So this is my direct number. For veterans, the best way for them to reach me is actually through the call center. And part of that, they had asked for veterans to not kind of contact us directly, more if they're having an emergency. If I'm not there to pick up the phone, then there's staff that can help them kind of navigate if they're having an emergency, because if it does go to my voicemail, I may, my response time may not be for what they're needing at the time. Okay. Any questions? Oh, we have another question here. Okay. Vicky says, are details of what happened and who was the offender of an MST case ever shared with anyone other than the therapist and the client? Is there a chance of retaliation? When the veteran shares about the MST, it's within it applies to confidentiality. So anything that the veteran shares during their clinical care, is under confidentiality. So there would be a very low likelihood of retaliation because the provider, is that what you're asking for about, Vicky? Really, details are only documented if it's needed for documentation of medical or mental health care. It isn't shared with anybody else because it's a medical record. So it would be treated that way, as confidential, private.
Desiree, we have another question that came through the chat. And this question is, how often does the VA provide a peer support or professional to attend a comp and pen or SCD application?
Okay, say that again.
How often does the VA provide a peer support or professional to attend a comp and pen or SCD application?
I think that's a question that I don't know the answer to. However, I think the MST coordinator that works within the VBA would be able to answer that question. So if the participant who asked that question, you're welcome to email me and I can connect you to our VBA MST coordinator.
Great.
I'm happy to do that. Yeah.
Okay. Thank you, Desiree. So I encourage the other attendees to enter questions. Oh, here we go. We have another one from a participant. What is the best practice for encouraging vets to seek MST treatment when they don't want to? That's a great question.
the approach for us at the VHA is we're going to meet the veteran where they're at. We want them to feel empowered. We approach it with collaboration. So when we do, when I had talked about this screen that we do with all veterans, and at our VA we do really well with completion of that screener. That screener has, very much standard questions, but the third question that they added on maybe about 5 or 6 years ago was really an open-ended question asking the veteran, would you like to engage in care? So, and then we listen to them and we meet them where they're at. If they say yes, then we refer them to a mental health provider. If they say no, then we encourage them, if you ever are interested, then to please, let us know. And then we'll get you to someone. We have staff available for same day access if they want to talk to somebody about MST. I think if they don't want to, it really is about having them know what is military sexual trauma, because sometimes veterans don't know the definition because it's different. And it's much more of an expansive definition than what they may think of, and want them to know about what are the services available, right? We can't force someone into treatment, but the one thing we can do is provide information so that when they're ready, that they know that they can come back. And you can invite them to talk to you about it if they're ever interested, and then you can get them connected to me, or you can tell them you can talk with your VA provider about it, because all of our providers have been educated about what is MST and providing MST related care. That's a helpful question. Thank you for that question. I think I want to also highlight, when we do the screener for the veteran, there's 3 options. A veteran can say, yes, I've experienced MST. They can say, no, I have not experienced MST. They also can decline to answer that screener. And what happens in a 1-year time, that screener will be asked again. And for me, my hope is that we've developed a better rapport with that client. We've developed trust with that client, so that maybe when they're asked the next time, that clinical reminder or that screener, that they will be ready to share with us what their answer is. Then we can collaborate and then meet them where they're at. Mm-hmm.
Great. Thank you, Desiree. So we do have a few more minutes. I hate to waste this precious time we have, so I'm going to ask a question of Desiree and give other attendees an opportunity to type in a question in the Q&A box. But Desiree, my question for you, earlier in your presentation, you talked about MST, or you really mentioned MST being an experience versus a diagnosis. I'm just wondering if you could expand on that a little bit.
So when someone comes to the VA for MST related care, I think what we want to do is really, I think that what we want to do is make sure that it's not already an assumption like, oh, this person has MST, because we know individuals who've experienced an interpersonal trauma could have a range of diagnoses. So it's important to recognize this is a part of their experience, and what are their current difficulties? What is the difficulties in their functioning to inform their treatment plan? So it really does allow for personalized veteran-centered care when we approach MST as an experience and as not a diagnosis. So it really helps us to ask kind of what is a veteran needing right now? What are the concerns needing to be addressed, and really developing a treatment plan with that person.
Great.
Is that helpful, Zoe?
Yeah. We had another question come in from an attendee, and the question is, what is the actual timeline you found that it takes for a veteran to actually report the MST? So I guess, what is the average length of time from event to reporting?
I would say it really varies. In different, the data that we've been collecting for the clinical, the screener started in 2005. So that data is really about, we have about 15 years of data for veterans reporting if they've experienced MST or not. I would say in my experience, it can be a very long time, like decades. Veterans may have not shared with us, or veterans who are coming in maybe for their new initial appointment with primary care, and they feel comfortable to share about that with us in their first appointment. So I would say that it varies. And the important thing that we talk about with our staff is when someone does share that they've experienced military sexual trauma, we want to be supportive. We believe them. We ask them, collaborate with them about what is the next step that they would like to do.
Great.
Mm-hmm.
I have one more question I can ask, and again, just giving other attendees opportunity to type in your questions. This is kind of a big question, Desiree, and my question is, what is being done proactively to prevent MST in the first place? So we have all these services to, assist veterans who have had these experiences, but what is being done to prevent these experiences in the first place?
That's an important question. I really think the efforts of programming within the military, really on the active duty side, that trying to really address the culture around if a veteran does report sexual trauma, seeking care related to sexual trauma. So, I would say the probably asking on the DoD side, like what are the efforts that they're doing? I know we have SHARP programs in every branch. There's people that active duty service members can reach out to for assistance to really change the culture around seeking support and reporting or deciding to not report. At the Veterans Health Administration, we're really on the other side of their service time. So I do think that there have been efforts. I don't know the kind of specific efforts that are happening. We'd have to ask the DoD kind of more maybe the SHARP coordinators. If there's anyone on this call that may know, please chime in. But for us, at least on the VHA, our approach is really if they do tell us that they've experienced MST, we believe them. I think, when I shared in the beginning about the structure of the VA administration is that, when they come to the Veterans Health Administration for treatment, they don't have to have any documentation. They don't have to ever have reported it to get care. It is a different experience when they do go to the Veterans Benefits Administration and apply for service connection for a condition related to MST. That's more of a legal process. So that's why they have MST coordinators on the VBA side to assist our veterans who are applying for service connection in that process, because it is a different experience.
Thanks, Desiree. So I'm not seeing any additional questions in our Q&A or chat box. So I guess what we could do is go ahead and wrap up. I don't know if there's any final thoughts you have, Desiree, about the topic or anything left.
I welcome, I'm really thankful to share with all of you today. I hope that you found the information helpful in the work that you're doing to support your veterans. Please contact me if something comes up in the future, if there's a client that you're working with right now that you may have questions that maybe don't want to share today during the presentation. I'm happy to, we can set up a time to talk over the phone. You can send me an email. I'm happy to support you. What I find is it's really helpful that staff and providers and clinicians know what is military sexual trauma. It is a term that is very specific to the VA. So not many people may know about it if they don't work at the VA, which is why the VHA requires all providers coming in to do a training on it so they know what it is. So I'm just very thankful that I was able to share with you about what is MST and that that there's a point person like me at every VA that can help you, better serve your veterans.